This is Dr. George Morris, and this is November's President Video News letter for the Medical Society of Milwaukee County. Health literacy, I know you've heard about from me already, but we have been very fortunate to have a very distinguished visitor come to us to help start our health literacy collaborative, supported by the Medical Society of Milwaukee County. We are bringing together individuals in our community who are devoted to health literacy, and we brought Dr. Barry Weiss into our community because we really felt that we needed some outside experts to talk about this and to invigorate our health literacy community. Dr. Weiss has created the physician education materials on health literacy for the AMA Foundation, which is a wonderful source of information about how to get yourself up to speed on health literacy. And I thought I would have him say a few words about health literacy himself. Dr. Weiss, thank you, and thank you for coming to Milwaukee.
Yeah, it's great. I hadn't been to Milwaukee in a long time, so that's fun.
So when you're in a cocktail party and somebody says, well, what's so important about health literacy? What do you say to them?
Actually, some people say, what is health literacy? Okay.
Well, let's start there.
So we could start there. And health literacy, simply put, is the ability of a person to read, get, obtain information related to health and use it to make decisions about their health or their health care. And why is it important? Because if an individual can't read, get, obtain, and use information to make decisions about their health, either somebody's going to make decisions for them or they're going to make bad decisions.
Well, obviously you can tell people that don't understand what you're saying when you're sitting with them in the exam room, right?
You should be able to tell people what they need to know when they're sitting with you in the exam room. The problem is, and we see this every day, that clinicians think they're good communicators, but actually when they're talking to patients, they're using big words, concepts that people don't understand, because the public in general does not have good health literacy. The public didn't go to medical school, and we use words with patients. There are studies of individuals who have limited literacy skills that say patients don't understand words like screening test, bowel, colon, words that we use with patients every day. Patients don't necessarily understand those words. And so we all need to learn to, what I always say is we need to learn to talk to our patients like we would explain things to our grandmother. And everybody who's watching this video is a healthcare provider, and all healthcare providers are called at times by their grandmother or their sister or their friend who says, I just came back from the doctor and I don't exactly understand what the doctor said. Would you explain it to me? And so you explain it to your friend or your grandmother or your sister in very simple terms, and they go, oh, okay, now I understand. Why didn't that doctor explain it to the patient in those terms right at the beginning? That's what the problem is. This is a little bit like driving. If you say to people, you're a good driver, everybody's a good driver, right? And if you say to physicians, are you a good communicator? Everybody's a good communicator. But the truth is, everybody's not a good communicator. And sometimes with the best of intentions, we use words that we think are normal words, but the public doesn't understand them.
Some of those people are the ones who roll through those stop signs without stopping completely.
Those good drivers.
Those good drivers, absolutely.
Right.
So, and can you tell when you look at a patient whether they have low health literacy?
No, a lot of people have stereotypes in their mind of individuals who have low literacy skills, and it's true that there are certain population groups that have lower than average literacy skills. Older individuals, people from minority groups, people with limited education are much more apt to have low literacy skills and thus low health literacy. However, the most common profile of somebody who has low literacy skills is a white native-born American, somebody who doesn't necessarily fit the stereotype that people hold about low literacy skills. And you can't tell by looking at somebody. And actually, there have been studies on this, asking physicians after they've seen a patient to rate whether this patient had good understanding and good literacy skills, poor understanding, poor literacy skills, and the physicians are wrong all the time. They can't make decisions like that. So you can't tell by looking at people. And current recommendations from all the organizations involved in health literacy now is that you should adopt universal health literacy precautions, because about a third of the overall population has limited literacy and limited health literacy. and because in many population groups it's way more, you should just assume that people are not going to understand you unless you explain things to them like you would explain it to your grandmother. And if you do that, this problem will be addressed.
You gave a great example of a study done asking patients about mammography.
Right.
Can you share that?
Yeah, Dr. Terry Davis in Louisiana did a study a number of years ago where she interviewed people who had low literacy skills and asked them if they'd had a mammogram. Yes, they'd had a mammogram. She asked them to explain what's a mammogram, and 1 out of 4 of them explained something completely different from a mammogram. Which is a very rattling study to me, because I'm asking patients all the time, have you ever had a pneumococcal vaccine, a colonoscopy, a mammogram, whatever it is? And people say yes or no, but now I know that the 1/3 of the population with limited literacy skills, a percentage of those people, they actually don't know what you're talking about. And so we have to be much more careful. Actually, what's widely recommended is using the so-called teach-back technique. So, in fact, if you say to somebody, have you ever had a mammogram, and they say yes, you should ask them to explain what a mammogram is to make sure you're both talking about the same thing, and they'll teach back to you what you wanted to know.
That's actually a great foyer into having you recommend physicians access on the internet the educational materials that you pulled together.
Right, you can go to the internet, you look up American Medical Association Foundation Health Literacy Manual, and it comes up as a PDF file. And it's a document you have to read. And if you go look up health literacy, there are tons of articles on health literacy out there. It's a topic of growing interest. The Institute of Medicine has issued a report, the AMA, the Joint Commission, pretty much all facets of medicine are turned on to this issue, because we realize that if you're telling patients what you think they should do and they don't understand what you're talking about, the whole point of your visit was worthless.
Right.
And unfortunately, and actually there are studies, interviewing patients right after they leave clinicians' offices to find out what people understood, and they don't understand very much of what they were told. They have to call their friend the doctor for translation.
Well, once again, thanks for coming to Milwaukee.
Yeah.
And this is Dr. Morris saying that you should definitely access those teaching materials for physicians on patient literacy, because you'll be surprised of some very simple things that you can do. And the nice thing about this report is it contains lots of wonderful examples and some very simple things that you can do, including the teach-back method, that will actually lead to an improved communication with your patients. And I think that's something the Medical Society has no trouble supporting. So this is Dr. George Morris, President of the Medical Society of Milwaukee County, calling on you once more to treat your patients. Thank you.